Have you or some of you love been forgetting things more often lately? Struggling with everyday tasks or feeling confused in familiar places? These could be more than just signs of aging. They could be early signs of dementia. In today's video on HeInfo, we'll break down what dementia really is, its causes, symptoms, treatments, and how to lower your risk, all in clear, simple language you could trust. What is dementia? Dementia is a broad term used to describe a significant decline in mental abilities that interferes with daily life. This includes problems with memory, language, problem-solving, and other cognitive functions. The most common cause of dementia is Alzheimer's disease. Key facts about dementia. Dementia is not a single disease, but a group of symptoms that result from different brain disorders. These symptoms are caused by abnormal changes in the brain that affect a person's ability to think, remember, and perform everyday activities. People with dementia may also experience changes in mood, behavior, and how they interact with others. Alzheimer's disease is responsible for 60% to 80% of all dementia cases. Another common type is vascular dementia, which occurs due to reduced blood flow in the brain from microscopic bleeding or blocked blood vessels. Some individuals may have more than one type of dementia at the same time, known as mixed dementia. It's important to know that not all memory loss or cognitive issues mean someone has dementia. Conditions such as thyroid disorders and vitamin deficiencies can cause similar symptoms, but may be reversible with proper treatment. Clearing up misconceptions. Many people still use the term senility or senile dementia, mistakenly believing that serious mental decline is just a normal part of aging. However, dementia is not a natural part of growing older. It is a medical condition that needs proper diagnosis and care. Recognizing the symptoms and signs of dementia. Dementia symptoms can vary widely from person to person, but they generally involve problems with memory, thinking, and daily functioning. Some common early signs include difficulty with short-term memory, frequently misplacing items like a purse or wallet, struggling to pay bills on time, challenges in planning and preparing meals, forgetting scheduled appointments, trouble navigating familiar areas, or getting lost easily. These symptoms tend to develop slowly and worsen over time. This gradual decline in cognitive ability is a hallmark of dementia. If you or someone close to you is noticing these changes, especially memory problems or difficulties in daily routines, it's important to seek medical advice. A professional evaluation can help identify whether the symptoms are due to dementia or another condition that may be treatable, such as a vitamin deficiency or thyroid issue. Early diagnosis can make a significant difference. It allows individuals to take advantage of available treatments, consider participating in clinical research, and begin planning for the future with clarity and support. Causes of dementia. Dementia results from damage to brain cells, which disrupts communication between them. The brain is made up of different regions, each responsible for specific functions such as memory, decision-making, and movement. When cells in a particular area are damaged, that area can't function properly. Each type of dementia has unique patterns of brain cell damage. In Alzheimer's disease, for example, abnormal protein buildup interferes with healthy brain function. The hippocampus, which is essential for memory and learning, is often the first region affected, explaining why memory loss is usually an early symptom. Although many brain changes linked to dementia are permanent and worsen over time, some conditions that mimic dementia symptoms can be treated. These include depression, side effects from medications, excessive alcohol use, thyroid imbalances, deficiencies in vitamins like B12. How dementia is diagnosed. Diagnosing dementia is a detailed process, as there is no single test that can confirm it. Instead, doctors use a combination of tools to assess whether a person is experiencing dementia-related symptoms. The diagnostic process typically includes a thorough review of medical history, a physical examination, laboratory tests to rule out other conditions, an evaluation of changes in thinking, behavior, and daily functioning. These steps help doctors identify signs that strongly suggest dementia. However, determining the exact type, such as Alzheimer's, vascular dementia, or another form, can be more challenging. This is because the symptoms and brain changes often overlap between types. In some cases, a doctor may diagnose a person with dementia without identifying a specific type. When this happens, further evaluation by a specialist may be recommended. Specialists such as neurologists, psychiatrists, psychologists, or geriatricians can conduct more advanced testing to pinpoint the exact form of dementia and guide the best treatment approach. Dementia treatment and care options. While there is currently no cure for most types of progressive dementia, including Alzheimer's disease, treatments are available that can help manage symptoms and improve quality of life. Medical treatments. 2 FDA-approved medications, donanemab, Kisunla, and lecanemab, Leqembi, have shown promise in slowing cognitive and functional decline in people with early-stage Alzheimer's. These treatments work by targeting and removing beta-amyloid, a protein that builds up abnormally in the brains of those with Alzheimer's. In addition to these newer therapies, other medications can temporarily ease symptoms such as memory loss, confusion, and behavioral changes. These drugs are sometimes used not only for Alzheimer's but also for other types of dementia, depending on the individual's symptoms and overall health. Non-drug approaches. Non-medication strategies, such as cognitive stimulation, physical activity, structured routines, and caregiver support, can also play a crucial role in managing dementia symptoms. These approaches can help reduce anxiety, improve mood, and maintain independence for as long as possible. The importance of research and clinical trials. Progress in dementia treatment relies heavily on continued research and clinical studies. Volunteers are urgently needed to participate in clinical trials to help scientists better understand dementia and develop more effective treatments. By joining a study, individuals contribute directly to finding solutions for current and future generations. Whether you're living with dementia, caring for someone who is, or simply interested in helping, getting involved in research can make a meaningful difference. Dementia risk factors and prevention strategies. While certain risk factors for dementia, such as age, family history, and genetics, cannot be changed, there is growing evidence that adopting a healthy lifestyle may help lower your risk. Research presented at the 2019 Alzheimer's Association International Conference highlights the powerful impact of combining multiple healthy habits. These include eating a balanced, nutritious diet, avoiding smoking and tobacco use, engaging in regular physical activity, challenging your brain with mental and social stimulation. By making these lifestyle choices, individuals may reduce their risk of cognitive decline and potentially delay the onset of dementia. While no single change can prevent dementia entirely, a combination of healthy habits can support long-term brain health and overall well-being. Dementia affects millions of families, but with early detection, proper care, and continued research, there is hope. If you found this video helpful, don't forget to like, share, and subscribe to HeInfo for more easy-to-understand health education. Have questions or want to share your experience? Drop a comment below. We'd love to hear from you. Stay informed, stay healthy.